It is, of course, the time of year where seasonal illnesses are floating around. Things going around right now include the flu, your common colds, COVID-19, norovirus, and much more. There are things that you can do to protect yourself and identify which illness you have if you start coming down with something. Joining us now is Sara Wilson-Rector, an advanced practice registered nurse with the Premier Physician Network. Thank you so much for joining us.
Yeah.
Out of all the illnesses we see in the winter, which are you guys seeing the most this season, and who's most at risk for it?
So, I mean, thus far, I would say we've had a combo. We had a good swoop there of kind of the GI bugs going around, some of the norovirus and just other, GI related illnesses that are viral in nature. And then here in the last few weeks, I'd say we're starting to see the ramp up, especially after Thanksgiving, which we tend to usually see that. Things like influenza A, I've seen a lot of that more so in my younger population, I would say, my kids and teenagers, things of that nature. But it's the season of all the viral illnesses. Those that are usually going to be most at risk are typically going to be both ends of the spectrum. So our very young and our older adults. In the mix of that as well, anyone that does have other chronic illnesses that potentially lowers their immune system a little bit, they are going to unfortunately be a little bit more likely to catch some of those viruses.
Now, if someone feels like they are starting to get sick right now, how do they tell what they have and how contagious it is?
Well, I would say sometimes, unfortunately, we can't always tell you 100% exactly which virus it is. I would say most of the time, when folks come in, if we're getting, the fevers and the chills, things of that nature, we can easily and we will very much run things looking for things like influenza, COVID, and RSV. But there's tons of other viruses out there that can make us not feel good. And sometimes we can't totally tell you what it is, but we treat it very much from a symptomatic standpoint. With that being said, usually the biggest thing is if you're not feeling well, we would say stay home, especially if you do develop a fever. That would be what's designated as 100.4 or higher as far as actually designating for a fever. And if we have one, we want you to stay home because otherwise the likelihood of passing that and kind of giving it around to your friends and family is significantly higher.
What steps should we be taking to prevent catching these illnesses?
Good hand hygiene, as you mentioned previously, is probably one of the number one things. Making sure that you're remembering to covering our mouths with coughing, trying to remind probably our kiddos at home to do the same thing. And then prevention. So getting your sleep, making sure we're getting plenty of rest, hydrating really well, nourishing our bodies. Exercise is big. Honestly, it does help to boost the immune system. Just taking care of yourself as a whole this time of year is going to help decrease some of those stress levels and cortisol, which then helps to boost that immune system.
How about if you've already had it and now you want to recover? What are some things that you should be doing then?
A lot of those same recovery pieces are going to be some of those prevention pieces, of course. Unfortunately, sometimes it's a little bit of a waiting game. We don't always have a magic medication to make it go away immediately, but taking the time to rest, don't push yourself. If you do still feel like you're sick and you have to go out, wearing a mask actually can be prevention for both yourself and for others around you. But remembering to listen to your body and give yourself a good little bit of time to rest and get back to your normal.
For parents, when it comes to keeping kids out of school, what are kind of the guidelines for that? Or for yourself, if you're wondering if you should stay home from work?
Temperature is probably one of the easiest objective ways to know. If you have a temperature, kids, or honestly, those of us that are working, we really should stay home. That old rule of thumb of being fever-free for 24 hours without fever-reducing medications is honestly very, very important. Taking Tylenol and then going in because you feel okay for a few hours is actually a really good way to spread some of those illnesses. But honestly, the other rule of thumb to me is if you just really feel poorly, that's probably a good indication that whatever you are fighting off is going to be something that is definitely contagious, and we should keep it at home if possible.
All right, Sara Wilson-Rector, an advanced practice registered nurse with the Premier Physician Network. Thank you so much for being with us.
Thank you.